Hey, this is Dr. Rob, and I wanted to welcome you here today to my next whiteboard session. Today we're going to be talking about a specific gene that can potentially be connected to conditions like chronic fatigue syndrome, joint pain, and other types of health problems. The name of the gene is called MTHFR, and it stands for methotetrahydrofolate reductase. I know, big word. We're just going to call it MTHFR from this point moving forward. So what is this gene and what does it do? Well, one of the things it does is it converts the synthetic form or inactive forms of folic acid, which is one of your B vitamins, vitamin B9. It converts the synthetic form of folic acid into its active form of folic acid, known as 5-methotetrahydrofolate. So the purpose of that gene is the conversion again of the inactive form or synthetic form of folic acid to the active form of folic acid known as methotetrahydrofolate or 5-methotetrahydrofolate. So when a person has a problem with this particular gene, one of the things that happens is they cannot properly convert the folic acid, the synthetic folic acid or some other forms of folic acid into the active form of folic acid. And that's a big problem. And the reason why is because if your body can't convert that into its active form, then that synthetic form of folic acid, it builds up in your system. It builds up in your body, and it actually becomes a poison. It's been shown to increase your risk of breast cancer. So pregnant women that were actually taking the 800 micrograms of recommended folic acid per day, there was one study that showed a 20 to 30% increase in breast cancer. It was shown to increase colorectal cancer. It was shown to increase prostate cancer. It was theorized because it interferes with your immune system's ability to function properly and fight off cancer. It's been theorized by researchers that that synthetic form of folic acid can actually increase your risk of all cancers. So you need to know for sure if you have a problem with that gene, MTHFR. Because if you do and you're taking a synthetic form of folic acid or the incorrect form of folic acid, then that folic acid can accumulate in your body. When it accumulates in your body, it is a poison. There's people that have taken folic acid in their multivitamin or folic acid through their supplements for years, and they've developed joint pain, and they had no idea what the joint pain was from. And when they stopped the use of the folic acid and started a natural protocol, their hands, their joints improved. So folic acid, when it accumulates in the tissues of the body again, it is a poison. I want to be clear about that. If you cannot convert that because you have this genetic defect, it is a poison. That poison can rob your body of energy because your body's just accumulating with this toxin, literally. So it can rob your body of energy. So if you already have an autoimmune disorder like rheumatoid arthritis, it has the potential to make it worse. If you already have chronic fatigue syndrome, it has the potential to exacerbate that or make that worse. If you're suffering from an inflammatory condition, really anywhere in your body, or typically any autoimmune condition, taking synthetic forms of folic acid when your body has a problem with the gene MTHFR can cause big issues. And I'm going to tell you, because I know some of you are going to go to Dr. Google right now. You're going to be like, Dr. Google, do I have this problem and what should I do if I have it? This is one condition I'm going to tell you do not play around with. Even if you are a doctor, which us doctors are just notorious for treating ourselves and making guinea pigs out of ourselves, guilty as charged. But this is one thing you don't play around with. You work with another doctor if you're a doc or if you're a patient. You work with someone that knows this information, that understands this gene, and understands the different approaches to helping support a person's body if they have that genetic problem. So this is a serious thing. I want you guys to take a look at this MTHFR, methotetrahydrofolate reductase. It's a good idea to get yourself tested, and it's a great idea, and really, in my opinion, the only idea. Work with a qualified doctor or a healthcare professional that knows this stuff and can get you the correct help that you need. If you have any questions on this, you could email me directly. I'm actually going to list my email at the bottom of this in the stuff down there, the bottom there. So I'm going to list my email information. So if you have any questions, you could email directly because this is something you really shouldn't play around with, okay? So I hope you've enjoyed this next whiteboard session, and I look forward to seeing you at the next one. Thank you very much.